Hello, my name is John C. Luna, and in this video series I documented my treatments at the Florida Center for Hormones and Wellness. During the treatment, I tracked my weight, diet, exercise, supplements, procedures, and even my sexual activity to provide a fair, accurate, and non-biased view of the changes I experienced.
In part 1 of this series, I underwent 3 pulse wave treatments, and on the 38th day, when I got the 3rd pulse wave treatment, I also got the Priapus Shot, or otherwise known as the P-Shot, where 60 cc's of my blood was drawn, placed in a centrifuge, and separated the platelets from the rest of the blood. Then, the platelets were re-injected into several parts of my penis, including the head and the glands. This process of re-injecting platelets has been used in sports medicine for years. The platelets stimulate growth and healing. After the procedure, I received a penis pump from the center. I was a little curious about it. I was instructed to use the pump twice a day for 10 minutes for the next 6 weeks. The idea is, by creating a negative pressure around the penis, blood is drawn into the tissue, further promoting healing and increasing the benefits of the P-Shot. As part of the treatment going on, I did 3 treatments of something called the pulse wave treatment, in which there's a device that essentially creates a certain frequency of vibration, and they send it around the genital area as well as the surrounding tissue. And it's not something that's painful. You are given a little numbing cream because it does vibrate you a little hard. But I've been through 3 of these treatments 1 week apart. And during that process, as I'm told by the doctor as well as his staff, that it does cause some little damage to the cells, but it's minimal. It's not anything painful. When it's done, you're fine. But it does that to help stimulate growth, basically stimulate healing. So we went through those 3, and again, it was 1 and then a week, another 1 in a week. And then on the 3rd one, after I had my pulse wave treatment, I was given something called a Priapus Shot. And I know I've spoken about this before. Essentially, they take your blood out from your arm and go ahead and put it in a centrifuge, remove the plasma, the part of your body that stimulates healing. And then they gave me a nerve block, which it pinches a little bit, but it wasn't anything bad. And then inject that plasma back into your penis in different areas. And in total, I had 5 small injections. They went very quickly. The whole procedure, once I was numbed up, took about 30 seconds. It was nice in and out. And one thing I will say is, after getting the P-Shot, I did notice, because it took a little while for the anesthesia to wear off. Again, it was local, they did. The few days afterwards, I wasn't quite as sexually active. However, it's been now over a week since that's been done, and my performance, everything is getting much better. There's been so much improvement. So obviously with this, I've changed diet and exercise. I'm doing vitamins more. As part of the P-Shot, an interesting thing, now I own a penis pump, because part of the treatment is twice a day now, morning and night. I use this to, obviously on my penis, to pull the blood into the penis, to go ahead and leave it there. It's usually done in 10 minutes in the morning, 10 minutes at night. But creating basically a vacuum and pulling more blood into the penis is going to go ahead and help stimulate the healing, which is what we want to do, being I had just done the P-Shot. It kind of aids with that. So all of these things kind of work in obviously cooperation together, both the vitamins, the testosterone pellets, the P-Shot with the vacuum pump, the little bit of change in diet, the intermittent fasting, as well as I've also been trying to exercise. I also travel a lot for work, so that sometimes is not an option. Now, as I've been documenting all of this, I can tell you before I started this treatment, going back more than 45 days ago, me and my wife would have sex usually 2 to 3 times per week. And it was good sex. It's sometimes, as any man in their 40s will say, the penis doesn't always work exactly when you want it, and sometimes they work great. Since then, in the last few weeks, we have been averaging sex 6 or 7 times a week. It's longer. We're going actually close to an hour or more. It is definitely, we can both feel the erection is larger, stiffer, just honestly overall better. But even putting all that aside, I have more energy. I'm able to work longer. I feel more focused and able to concentrate a little easier. So again, there's a lot going on with this treatment, and everything from vitamins all the way up to balancing testosterone. And one other thing they did find out, I had a advanced metabolic test done on me, which I'll be getting the results next week. And that it actually is going much deeper than what a doctor's blood test will do. You would have to be sent off to a special lab. And the reason is, we're going to be looking into my insulin levels and how they behave, as well as not just testosterone, your blood sugar. There's a whole bunch of other things that normally aren't even documented or tested for in what I would normally get in, say, an MD physical I'd get from my MD. Okay, so I'm back at the Florida Center for Hormones and Wellness, and we're getting the test results back from my advanced metabolic blood tests. So let's see how they went.
So here we are, and today we're going to go a little bit off of the sexual side of things, and we're going to focus a little bit about the long-term health and wellness, okay?
Okay.
And one of the things that I like to do is so hormones are so crucial toward overall health and wellness. That's why we want to deal with them first, because they control and interact with so many different body systems that getting that is a stable launching point to then jump off and to get into the physiology is a good thing to do. It's easy, people feel good faster, so they get more invested and involved in the program because already they can see things changing within 4 to 6 weeks. Then what we do on that is, and if you look at it, if I were to put a percentage on there is how important are hormones to overall wellness, I'd say it approaches 50%. So it's the biggest chunk, it's the easiest to do, it's the fastest result, and then we build off of that. And we're going to take a look at a couple of different things with you. And the first one we're going to look at is what I like to call advanced metabolic testing. A lot of people call it advanced lipid testing because it was primarily devised to look at cholesterol metabolism in a very advanced way. A lot better and more informed, or getting more information than the standard 5 cholesterol panel that everyday doctors get. And I kind of like to bring up the example that there was a famous newsman out there, used to be the anchor of Meet the Press, and his name is Tim Russer. And Tim Russer, he was doing everything he could. He had good insurance with NBC, and he was going to the doctor, and all of these kind of things that they do. In fact, a lot of these big companies have key people, and then they make them go to the doctor and do advanced things. And he was kind of in one of those programs. He went to the doctor, he had a stress test, he had all of his cholesterol done, he was on a statin, and 3 weeks later, after he got a clean bill of cardiac health, he had a massive heart attack and died. Well, that shows you the problem with the 5-panel standard cholesterol test. It tends not to give the big picture, and in fact, it actually misses to some degree what's called the inflammatory type of cholesterol problems that people have. And the inflammatory ones tend to present more with sudden death, whereas the non-inflammatory tends to present more with chest pain. And when you get chest pain, you kind of get the warning that you can go to the emergency room, you get your stent placed, and you go on with your life. That's the non-inflammatory kind. The inflammatory kind tends to sit there and brew and build up, and all of a sudden it breaks through the blood vessel wall and it sends a big geyser of this garbage into your artery, and it causes a clot. And if you get a clot in the main artery of your heart, it's all over. You don't get a chance to get to the emergency room to see if you can put a stent in there or clean it up. It's done, okay? So when you look at the advanced lipid profile, which is probably 2/3 to 3/4 of what we're going to go over right here, you get to actually address that inflammatory type of plaque and institute some things which may actually have a benefit to be heart cardioprotective and avoid or lessen that risk. So if we look at it, the standard 5 panel looks at about 35% of cholesterol mediated risk, and the advanced profile looks at another 60% of that cholesterol mediated risk. So you're looking at about 90% of that cholesterol mediated risk in this panel. And there's a few other things that get less and more and more obscure that are just really not easy to find and not easy to treat. So we're not at that point where we're drilling all the way down. But we're going to get a good chunk of your cholesterol risk identified here today if you do or do not have it, and then put in some recommendations on how to address them. And then the other part of that is what we're finding is to be more and more important is looking at your sugar metabolism risk. And that's another big thing. And sugar metabolism is becoming more and more important. Sugar metabolism directly impacts cholesterol, but it also directly impacts other things in terms of longevity and the development of heart disease and a multitude of other diseases of aging. So that's why I want to look at these two things today. We're going to go through this test here briefly, and I'm going to outline a couple of things that I think we need to do, okay?
Well, yeah, considering, one, heart disease runs through my grandparents. All 4 of them have it. My grandmother actually had a triple, single, and double bypass before she passed. The other one is, as far as sugar, over the years, I have even gone to drinking black coffee and have constantly cut down less and less on sugar, yet losing weight has always been a challenge for me, and even maintaining weight. So I'm really interested in hearing what's going to be on these tests.
Excellent, okay. And I apologize, we got this done, it came back, and I don't have the hard copies, which are usually nice and in color. But we'll go over these today, okay? So if we look at your standard cholesterol panel, you actually would go into the doctor and you go, hey, it's not too bad. Your total cholesterol is 150. Your bad cholesterol is really just outside of the basic range of 100. Okay. So just a couple of points over that. The one thing he would say is that your good cholesterol is a little bit too low, and the standard recommendation for somebody like you would be, eat a little bit, eat a more low-fat diet, exercise a little bit more, and then we'll decide down the road if you need a statin, okay? I look at this and go, okay, this isn't good enough for me, okay? I mean, I don't care whether you're borderline, I want you to be optimum, and optimum means going for a little bit of a stricter standard, okay? So I really want your total cholesterol is good. I'd really like this to be about 80 or less, certainly well below 100, and I would really like your good cholesterol to be 50 or higher, okay? And in order to do that, we're going to talk about a few things as we see some other things unfold down here below, okay? Now, when we look at the bad cholesterol, what gives us a little bit more information is looking at what we call the morphology, or the size and the shape and the counts of these particles, okay? And so what we do is in an advanced metabolic testing, we look at the actual particle counts and particle sizes. And what we find, yes.
Just to stop you, this is where a normal blood test would stop.
This is it. This is all an everyday doctor would do, is just up here.
You'd get these 3 numbers, they'd make one evaluation, and we'd be done.
And you'd be done. So this fits within, this totally easily fits within. He would, if it were bad, he would say, okay, it's not bad, do a little bit more exercise and watch your fats. That takes about 30 seconds to say that. Or if it was worse, well, it's bad, you need to be on a statin, and he throws a statin on the table. And a statin will increase the risk of diabetes, of erectile dysfunction, muscle aches and pain, and it'll diminish your energy in some people that are prone to the side effects.
Wow. Okay.
Okay? So, and I don't want to do that. So I don't want medicines that have
that.
those kind of side effects. So we can do that in another way.
When I started with the Florida Center for Hormones and Wellness, they went ahead and gave me an order for a company called Whole Scripts, which basically packages up your vitamins to meet your specific needs, and then goes ahead and puts them in nice little packages and ships them together. So again, I'm covering my address here. I ordered a bunch of stuff, and it was nice enough to go ahead then, actually, and then also put all the labels, because obviously it's custom-made vitamins to an extent. And you can see here, the list just keeps going on and goes on to another page of how much it keeps going. And it's stuff like vitamin A, vitamin C, calcium, iron, vitamin D, vitamin E, vitamin K, thiamine, riboflavin, gotta love that weird word, niacin, vitamin B6, folic acid, I don't know, keeps going on, magnesium, selenium, I can't even pronounce some of these, but apparently these are vitamins that Dr. John Carozella had specifically tailored to me based on my recent blood work. So I'm opening it up now, and apparently they call it a med pack. It feels like Christmas, just on a more adult level here. And it comes like this with a med pack, personalized medicine they call it. And let's open it up and take a look. And essentially, ooh, it's a nice roll tube of them. But each one, let's see if you can see over here, has 1, 2, 4 pills. I'm trying to look. And it lets me know which ones are for AM and which ones are for PM. It's Tuesday, so on Friday, 5 days ago, 5 days, I went ahead and had 5 additional testosterone pellets inserted into my right glute. Previously, when I started this 57 days ago, about 40 some odd days ago, when they put it in my left glute. And the reason is the testosterone levels came back. They weren't quite the results we wanted, so they added a little bit more over at the Florida Center for Hormones and Wellness. But wanted to give you a summary of it. Basically, the procedure itself was absolutely painless. You feel a little prick from the lidocaine and a little pressure. Then they bandage it up. They cover it up with plastic, something called, I forget what he calls it. It's basically Sanoderm. It's a plastic covering that goes over, so I could take a shower. Basically, I just couldn't do squats and I couldn't take a bath. That is the only restrictions I have. No heavy exercise for about 5 to 7 days. Since then, today I'll be removing the bandage. I've been taking something called Arnica, 5 micro little pills 3 times a day to help with the swelling, and occasionally I took Tylenol. But besides that, there really wasn't any pain. It really hasn't affected me much. It's been great.
4 days later, the morning of day 54, I removed the outer bandage. The most uncomfortable part was the bandage sticking to my body hair. In all honesty, it didn't hurt. There wasn't much bruising, and 4 days later I removed the inner bandage, the steri strips. Even just a week later, the incision bark was mostly healed, and after a few weeks it became nearly unnoticeable. I've here a doctor do, which is to use a penis pump. And no, for those of you born in the 80s, it is not a Swedish penis pump. It's actually made by LA Pump over here. But I've been using it, I have missed a few, I will admit, life happens, but I've been using it fairly strict in the morning when I first wake up, and then at night before I go to bed. And I want to give some feedback on this. First things first, don't try, if you use this, to ever pump up as much as you can immediately. What they recommend is 10 minutes, and there's a little gauge over here. They want to get you up to 10, I guess that's 10 PSIs. However, don't ever try to get there on your first try. It takes time to get up. Maybe do 10 minutes at 5, then 10 minutes at 6, and 10 minutes at 7. So it took me about 2 weeks, 2 to 3 weeks really, to the point where I can actually get at or above 10 on here without it being painful. And it wasn't so much painful on the penis itself. It was painful the fact that it pulls your tissue in as well to this little part over here, as well as pulling your penis in. So not so much painful, maybe uncomfortable. However, when you go ahead and do it, and you do get up to at or above 12, and right at 10, you do actually, as you pump, see your penis grow. And I've learned to do it slowly, to go ahead and let the skin adjust and get it in there. After doing it every day now for over 30 days, twice a day, again, most of the time, I have noticed a significant increase, especially for the hour after doing it. But even during the day, I have to say, continually using this is working, at least for me. Again, it was done in collaboration with 3 P waves, or pulse wave therapies, and then also with something called the P Shot, which I explained earlier. And I am, of course, continuing on with vitamins, as well as a nitric oxide booster, and honestly just trying to eat healthier. and do a little exercise. So all of those put together with this have been working.
In the next part of this video series, we'll be covering John's weight loss and the changes he experienced in both his general activity and his sexual activity.